Why are urodynamic studies used for OAB diagnosis? Imagine trying to understand how your bladder works without actually looking inside. That's where urodynamic studies come in. They are special tests that help doctors see how well your lower urinary tract is functioning. These tests measure how your bladder stores urine and how it releases it. They can spot if your bladder muscle, called the detrusor, contracts involuntarily. Such contractions can cause the urgent need to go, frequent trips to the bathroom, or even accidental leaks that are common with overactive bladder. Even though doctors usually diagnose overactive bladder based on symptoms you tell them, sometimes those symptoms aren't enough to tell the full story. Urodynamic tests give objective, detailed information that can confirm if your bladder is behaving abnormally. They are especially useful if your symptoms are unclear, if treatments haven't worked, or if more invasive procedures are being considered. These tests can also tell the difference between different types of urinary leaks. For example, they can distinguish between stress urinary incontinence, which happens when pressure causes leaks, and urgency urinary incontinence, which is linked to involuntary bladder contractions. During a urodynamic study, the doctor measures how much your bladder can hold, how stretchy it is, and how it behaves during filling and emptying. They look for signs of detrusor overactivity, which is when the bladder muscle contracts involuntarily during filling, often leading to urgency and leaks. They also check how well the bladder and sphincter muscles work together when you urinate. If there is an obstruction or if your bladder isn't emptying completely, the test can reveal that too. This helps the doctor rule out other causes of your symptoms, like infections, blockages, or nerve problems. While urodynamic testing is considered the gold standard for understanding lower urinary tract function, it is invasive. It involves inserting small catheters into your bladder and sometimes your rectum or abdomen. Because of this, it carries some risks, such as urinary tract infections. That's why doctors usually recommend urodynamics only if your symptoms do not improve with simpler treatments or if there is uncertainty about the diagnosis. Many guidelines suggest using these tests, mainly for cases that are resistant to initial therapy or before considering surgery. From a bladder health perspective, urodynamic studies are very helpful in making sure that your diagnosis is accurate. They can also identify other conditions that might mimic overactive bladder, such as bladder tumors or neurological issues. This careful assessment helps prevent misdiagnosis and ensures you get the most appropriate treatment. In the end, these tests give your healthcare team a clear picture of how your bladder is functioning, guiding them to choose the best options for managing your symptoms and improving your quality of life. Remember, always consult your healthcare provider for personalized advice and treatment options.